Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Good morning and welcome to a Cardinal Minute. I'm Dr. Kim Allen Williams, chair of medicine here at the University of Louisville, and we had a wonderful internal medicine grand rounds this morning. It happened to be our 2024 Lung to Yam lecture that is hosted by the Hematology and Oncology Division. And we have with us our division chief or section chief, Dr. Mohammed Hagazi. And we actually have our guest, Dr. Monzr Malki, who is the director of the bone marrow transplant program at City of Hope in California. Dr. Malki, can you give us a 1-minute summary of your discussion this morning?
Yes, hi, and nice to meet you all. In our talk today, we discussing the importance of alternative donor transplant in the current era. And we have, discussed the historical outcome of mismatched unrelated donor using a conventional GVHD prophylaxis. Later on, we moved on to optimizing the choice of donor based on HLA characteristics. And after that, we were discussing advances in GVHD platform that have led to improvement in the outcome of this donor using post-transplant cyclophosphamide, as well as abatacept as initial approaches. And later on, we discussed some of the future direction that could hopefully in the future improve and help with this unmet need. Thank you.
Fantastic. Dr. Hagazi, did you want to put in any perspective?
I think Dr. Almaki has covered it very well. The only thing that I wanted to bring up is this is bringing transplant to more people who were not giving the option or the choice. And that's what Dr. Almaki is trying to reach more patients who were denied a transplant in the past. With these innovative approach, it is a viable option to cure their disease and have them live longer. Thank you, Dr. Almaki, for putting all this together.
Thank you.
Fantastic. And hopefully you all will see us on the Louisville lectures and view Medi and listen to the entire lecture. And this has been a Cardinal Minute.